stay for a couple of weeks, and engage in intensive therapy. So to do that, you have to be wealthy, and you have to be highly motivated. And I doubt that you would have jumped on a plane to go see Masters and Johnson if you were disinterested in sex. What's the point? So they had no concept of the lack of sexual desire. In this study, then, they put lack of sexual desire under what's called a minor difficulty, which is totally out of place. It should be under the category of a major sexual dysfunction. And what they found is that 35% of the women reported being sexually disinterested, which, by the way, is very consistent with a number of other studies that have been done on lack of sexual desire. The major surprise in the study, particularly back in 1979 when the study was published, was the statistic regarding men. They found that 16% of the men said that they were sexually disinterested. So that's about 1 out of 5 men saying that they were sexually disinterested. And again, that goes against the common mythology that men are always in the mood for sex. And the final two problems I'll talk about are too little foreplay before intercourse. Of course, we hear this problem discussed frequently by women who come to therapy. In this study, 38% of the women talked about too little foreplay. And what was interesting is that 21% of the men said there wasn't enough foreplay. Again, that's a surprise. It goes against the common mythology that men aren't that interested in foreplay. They want to jump in bed, go straight to sex, bypass everything else. I hear a lot of women come into my office say, well, my husband's idea of foreplay is tweak my nipples a couple of times and maybe a little bit of the clitoral area, and then 5 seconds have passed and he says, are you ready to have sex? And what am I going to say? Because if I say, no, I want more foreplay, he looks at me like, but I just gave you foreplay. What are you asking me for? That's foreplay. So the women know that their husbands just have no clue, they don't get it, they're not going to get any more than they're going to get, and so they just say, okay, just go ahead and get it over with, and it becomes more of a duty or obligation for them. And then too little tenderness or afterplay. Again, women, 25% complained about this problem versus 17% for the men. What I'm seeing in my practice these days is that as men age, there tends to be a trend that men want more and more foreplay. And I think part of that reason is that as men age, the ability to get an erection tends to slow down very significantly. So if you think about a male who's, let's say, 16, 17, 18, so let's say they're sitting in a classroom taking algebra and they're having a sexual fantasy and they're getting an erection or they have a spontaneous erection and they're praying, oh my God, don't let the teacher call on me, I don't need to stand up and show off what's happening here. So these men, the younger men, don't really need much foreplay. They can get an erection very, very quickly. It's almost instantaneous. Whereas for the older man, the system is slowing down and they need more physical stimulation in order to gain the erection. And they need more psychological stimulation in order to gain an erection. So if you were to graph what happens with a younger man, for the younger man, if you start, this is baseline, they get the erection almost like this. With the older man, what you actually see if you were to graph it is what's called the scalloped curve. So they tend to start to get the erection, lose it a little bit, get it a little bit more, and keep going until eventually they get to a point where they have a sustainable erection, or what Masters and Johnson called an irreversible erection, which of course is a misnomer because we know that all erections are reversible, unless perhaps you've overdosed on Viagra or Caberject or one of the injectable medications. I've had a few clients come in referred by neurologists, and I don't know how they get their hands on this, but they get one of the injectable medications for erections. And they think, well, more is always better, right? And if you take a little bit of the drug, that's great. I want to have a really super duper erection. I want to have a Superman type of erection. So I'm going to just really shoot a lot of this drug, it's called alpha-stable, into my penis. And so they shoot a lot in. And I had one fellow that I saw, had an erection for 4 days. And this becomes extremely painful after a while, by the way. I had a client once who was actually he was an emergency room physician, and he was a former drug addict. And I thought to myself, if he ever gets his hands on this drug, Caberject, he's going to be in trouble because he's going to overdose on it. So he called me after treatment. He called me from Florida, where he was working, to tell me what had happened one day. We continued some therapy by phone after they left. This was in Philadelphia. And he told me this story about how he was trying this new injectable drug for erectile problems, because his wife was always complaining about his penis not being erect enough and not being erect long enough. And he said after 4 hours, it was really painful. And he said, I was sitting in bed putting ice on my penis, trying to make the pain go away, and I was just damn determined not to go to the hospital because there was only one hospital in the county, and he was the chief of the emergency room, and he said, this would be very embarrassing to go into my emergency room to have my erection reversed. And so he said, I'm just going to grin and bear it as long as I can. Now, the other fellow that I saw who had a 4-day erection was a very, very young fellow. He was in his early 20s. I don't know what he was doing, playing around with a drug as dangerous as Caberject or alpha-stable. But if the blood stays trapped in the penis too long, the tissue in the penis actually dies. And when that happens, you can never have an erection again normally. About the only thing you can do at that point is to go in and have the tissue, the corpora cavernosa, basically evacuated and have an implant placed. So then you have an artificially induced erection. And so that was the only choice that he was going to have as he moved forward. Now, I said there was a little gem